the program where we educate the public on contemporary health conditions. Today, we'll be talking about wound care. My name remains Dr. Femi Ogunremi. Wound care is an important topic. There are so many situations where people have injuries or they have a disruption to the, to the lining of their skin, and they do not know what to do. There are times where people had issue with their, skin to the extent that they've lost part of their limbs. Today, I want to share experience with two lovely men who will be joining me in the discussion. They've got a technology which I think it's worth us knowing about, which has saved a lot of people from, devastating situations. I have with me today Mr. Morrison and Dr. Maxwell Kuranga. They will be discussing with us today wound care, and then they'll be sharing their experience on the field. You're very much welcome, gentlemen.
Thank you very much, sir.
Okay. So can the public meet you? Can we start with Mr. Morrison?
Thank you for.
Okay, sir. Thank you, Dr. Femi, for this opportunity. I really want to thank you. My name is Mr. Morrison Okumbo. I'm the MD of Morrison Hedge Limited. We are into wound care technology in such a way that we manage wound with our technology. The aspect of the wound care, we manage.
Okay.
Can you hear me, sir?
Yeah, we can hear you. So
okay. Okay. We have a technology that manage the wound to accelerate wound healing. Can you hear me?
Yes, please carry on.
Okay. With a technology to accelerate wound healing using our disposables with the negative pressure machine.
All right, okay. So we're going to hear all about that today. What about Dr. Maxwell? Do you want to introduce yourself to us, please?
Yes, good morning. Thank you, Dr. Femi, for having this program. My name is Dr. Kuranga Maxwell, and the team of the wound care department at Morrison.
Right. I think we're struggling with your network, Dr. Maxwell.
Hello, can you hear me, doctor?
Yeah, we're hearing you, but you're slurring. We're struggling. Okay, that's fine. So that's okay. I think you're very much welcome. Maybe we should start by just defining what we mean by a wound, and then let people understand what we mean by a wound, and then from there we can wrap up. So, Dr. Maxwell, do you want to enlighten us? When we talk about wound, we want to talk about wound care. Okay, what is a wound, and how do we get to the stage where we talk about we're caring for the wound?
Yes, thank you very much. So, as we know, wound care is a type of healing that happens suddenly, leading to a lot of tissue, either a very sharp skin cut where the skin is torn, okay, or probably where the skin is punctured. It can happen to any part of the body. Tissue wound, could be wound to tissue, could be wound to organs, and it can happen on any of the human body. So different types of wounds. When it happens, when the wound that happens by a very sharp object, such as a razor that functions through the skin or the tissue, as the case may be.
We cannot hear you.
Also, we have the wound that happens first from. hear Mike clearer, please? Dr. Femi, can you hear?
Yeah, we're struggling to hear you really. Okay. So maybe you want to change your network or something, and then let's see what happens.
Yeah, I think, okay, okay, just give me a minute, please.
Okay, that's fine. We just okay. So while we're waiting, obviously Dr. Maxwell was trying to define what a wound is, and I think he was talking about a disruption in the continuity of the skin, and he's talking about what might be responsible for that. It might be an abrasion. It might be like
Hello.
and then, okay, carry on. Thank you.
Hello. So, about that, as I said, injury, which happens in which is torn or punctured, as in the case of an open wound. Blunt force trauma causes a contusion. In the case of a closed wound, it typically refers to a sharp injury which damages the epidermis of the skin. And there are different kinds of wounds, and there are different ways to classify wounds. Classification due to the level of contamination of the wound. Can you hear me more clearly?
Yeah, we're struggling, but
Hello.
We're struggling, but we just have to make do with this.
Can you hear? Okay, so we can classify wounds in two different classifications. Sometimes we just want to classification based on the level of contamination. So we have wounds under sterile conditions, i.e., the type of wound patient performs surgery. So a clean sterile, that is what you refer to as clean, the kind that comes with surgeries and other medical or surgical procedures. A contaminated wound. A contaminated wound is a kind of wound that usually results from an accidental injury, and they are pathogenic organisms contained in this wound. So a contaminated wound. Are you with me, Dr. Femi? Can you hear me?
I mean, I can just speak in between the lines.
Hello.
I'm struggling to pick what you're saying because I think that your network is a bit challenging this morning. Okay, so I think I'm just going to try. So I know you've talked about, you've defined, a wound, and then you're trying to go into the classification. And then you were talking about contaminated wound, if I understand what you were saying. And then you were talking about an infected wound, a clean wound, a contaminated wound, and an infected wound. So a clean wound is a wound which usually might be like a surgical wound where you clear the skin before you had the infection in the lining of the skin. And then there can be contamination when there is foreign thing enter into the wound but has not actually caused an infection. An infection is when you have high level of colonization. As an organism that can cause infection is actually seeded in this wound, and then that in itself is now a problem to the wound. So if I get you right, those are the three things that you probably have talked about. Okay, so thank you so much for that. So when we have, obviously, if you have a clean wound, you have a contaminated wound, or you have an infected wound, there are consequences to such wounds. And I don't know if we can just throw some more light into this for the public to understand what are the consequences of the kind of wound that you have, and how that is
kinds of
results that we get.
Okay. For wound, as you know, as the name implies, the clean wound is a kind of wound that heals on its own automatically. It will heal without any consequences because it is clean, it is not infected, and it is probably created for surgical reasons. Okay, are you still struggling with understanding?
Yeah, I'm still struggling to hear you, but it's okay.
So that's contaminated. It is like an intermediate stage between. It's like an intermediate stage between a clean wound that is not properly cared for, which brings us to why we are here to the wound care. Because even a clean wound may need some protection. That is what we're going to go into in a few minutes. So the contaminated wound is a clean wound that is left with that will then contact, as you have said, when there are foreign bodies or contaminants seeded in this wound, they may then begin to colonize this wound, making it infected. Okay, the device we are going to be talking about shortly under our wound care management regime, one that takes care of all these consequences, the possible consequences. And when the wound becomes infected, obviously, there will be new signs and new symptoms. The patient will exhibit certain symptoms, as we know. Is usually primarily the contact to an infected. Okay, it can also have pus become indurated. It becomes a contaminated wound, an infected wound where you have microorganisms colonizing the wound, proliferating on the surface of the wound, preventing wound healing. Okay, and sometimes, if left untreated, can also lead to sepsis, gangrene, which can ultimately lead to mortality. So these are some of the consequences of a contaminated or infected wound left untreated. So what we're going to be dealing with today, we have just classified wounds under classification due to the level of contamination. There are also different types of wounds. There are open wounds, closed wounds. There's a long list of open wounds, of course, incisions, like we mentioned, which would usually be a plain wound. There are lacerations, irregular tear-like wounds that can also happen on any surface. Okay, due to blunt trauma and incisions, they may appear linear or irregular. Also have fractures, which is open. Those are superficial wounds in which the epidermis, topmost layer of the skin, or especially happens maybe due to a fall, a sliding fall on a surface, maybe on coal tar, on concrete. Okay, that is a common wound for footballers, young children, youths who play ball on the streets, and all of that. Those avulsions, these are injuries, the body structure is possibly removed or detached from the normal point of insertion. I don't know if you can hear me, Dr. Femi, but I hope that
we actually
struggling. Maybe it's still audible.
Dr. Femi, if I may come in, can you hear me now?
Yes.
Can you hear me now?
Yes.
Okay. You see, all kind of wounds, you know, the wounds that we're looking at now is when you try as much as possible to cover it with the disposables. We have a range of disposables to prevent any form of external infection.
Mr. Morrison, let's start. I want to start first from how do you care for a wound? So let's do the basics, and then we'll come back to this level. So when we talk, how do you care for a wound? Yeah. We now know that there are consequences.
Okay.
Wounds. Obviously, if you have it, which is the best that we want, it's a surgical wound, well cleaned, and then there are no germs, there are no contamination. So the wound heals by what they call the primary intention. So edge, you bring them in, and there's no scar, reduced scar, and we have a very, very smooth skin. Like, let's come back. That is a surgical wound. That is a clean wound. That's what we're aiming for. But we not say that there can be contamination and there can be, an infection. Now, let's now talk about how to care for wound, whether it's simple wound, complex wound, whether it's an infected wound, whether it's a contaminated wound, whether it's surgical wound. How do we even care? What sort of care do we deliver? It's a shame that we're not hearing you well, Dr. Maxwell, this morning. But if you just try and tell us as much as you can, I hope we'll be able to pick in between the lines. So how do we care for wounds?
Yes, basic wound care, okay, originates with sterility. That means we have to at all times keep the wound clean and free from any external sources that can contaminate this wound. In doing that, some care centers use gauze, bandages to cover wound surfaces. But in a step-by-step format, wound care basically entails doing the wound either using our normal saline solution. We may use this by using different other solutions depending on the kind of wound. We have like you saw, okay, that's one of them. We also have cetrimide, one of the cleaning solutions. We clean wounds in order to rid them or keep them as clean as possible, bacterial colonization. After cleaning, you then have to cover the wound because it is not enough to clean a wound and leave it exposed. Of course, we all know that as we go along, there are different contaminants everywhere, even in the air that we breathe in. So it is not advisable to leave wounds open. So what we then do is to cover the wound after cleaning. In doing this, we use sterile equipment, sterile gloves, sterile surgical gloves, in order to maintain sterility and make sure that you as a surgeon or the wound carer is not introducing bacteria from any other source into this wound. So you have to put on your sterile gloves. You have to use sterilized instruments for the forceps and whatever else you're going to use. Okay. In covering the wound, you also have to use sterile materials. We use gauze, sterile gauze that have been sterilized, either in an autoclave or by any other means. Okay, we also use bandages. Some people also use crepe bandages to ensure that the wound surface is covered. Now, there are basically, of course, there are time lags for different kind of injuries to heal. But some of the major things we have to understand is there are factors that militate against wound healing, which is why this technology is very, very important. Now, some of the factors that militate against wound healing are anemia, as we already mentioned, infection, two basic reasons that prevent wound from healing on time. One, infection. Two, anemia. Of course, there are other factors like immunosuppression. There's some patients who have some chronic illnesses that reduces their immune system, their immunity, and the ability for the wounds to heal. We know a very common example of that one in the case of diabetics who have diabetic foot injury due to the peripheral neuropathy. Okay, so those wounds take a lot of time to heal. So what this technology does, as I will go into in a few minutes, it militates against each of these factors. First, in keeping the wound clean and in covering the wound, you have prevented any external infection. But that is not enough because the wound in itself, a lot of processes happen there, the wound surface, as we know. So what happens is we have a technology that is able to not just keep the wound sealed, it also helps with the negative pressure that it introduces to make sure that any contaminant that is coming from the wound surface itself as it develops, okay, can be taken out, like wound exudates can be taken out through the vacuum system. Of course, in the case of very dirty wounds, you know that we also do procedures such as the more. In the case of open wound, where there's no surface of the wound, you have to do a debris more on that wound, i.e., remove the dead tissue, dead skin surrounding it in order to allow for tissue granulation, fresh granulation from the surface of this wound. So this machine, this device, okay, which we will introduce to you in due time, has the ability to do a debris more on its own automatically, and I will explain that in detail. So when you have cleaned your wound, you have covered it, and you when necessary apply the necessary antibiotics, because of course the wound is infected, as I said, there must be a positive organism infecting that wound. So that's where you also talk about investigations, because you have to do a wound swab in order to know which organism has colonized or is colonizing the wound, in order to apply the necessary sensitive antibiotics. So all that comes in. Wound care is a total package where you have to mitigate against some of these factors that reduce the speed of wounding and the ability of wound to heal rapidly. You would also have to ensure that this patient is okay blood-wise. That is why I spoke about anemia. If a patient who is recovering or trying to heal the wound is not well, is not healthy, okay, has a low PCV or has anemia, as the case may be, this also will still mitigate against the rate at which someone will heal. So in cases of anemia, of course, we do blood transfusion necessary for really serious chronic wounds, okay? And then we just ensure that the patient is well nutrited, that is, the patient is well fed, okay? So those are some other factors. You militate against the anemia, you also prevent infection, okay? And this machine does all of this, Dr. Femi. So with your permission, I would like to introduce this machine we're talking about and maybe speak a little more about it. Maybe I marry it with the care, would understand better how this so-called machine. Yes, please.
Okay, sorry. I know there's a time lag, and I know that.
Yes, I can hear you clearly.
So thank you so much. We've heard, quite the way you explicitly, discussed, wound care. And then I know you're quite itchy and keen to tell us about this device, which I'm really keen to also, hear about. But just to clear the air, you're talking about, wound care. You've talked about, a clean head, clean wound and infected or contaminated wound. And it sounds like this particular device that you're talking about is quite useful, especially in situations where you have contaminated wound or maybe an infected wound, to promote healing. Now, a particular, someone asked a question around, wound pressure sore. That will this be useful in cases where you have pressure, sore?
Yes.
Okay. So can we actually, Dr.
Yes, which are some of the most.
Yeah, Mr. Morrison, space.
Sure.
I know you wanted to show us the picture of this device you're talking about. Can you share the video? We haven't gotten much time because we only have 30 minutes for this program. Can you show us this device and then maybe just tell us about it and then how this would be useful in when we use this for.
Okay. Enable your sharing command.
All right, sorry. Just a minute. Yeah. Okay, you should be able to share now. Is that working?
Okay. Yeah, it's working. You can see the machine here. This is the negative pressure machine, and you can see the disposable on the. Can you see it, sir?
We can. But why don't you use the slideshow?
Okay.
Yes. At the bottom. Just click on the slide in at the bottom. No, to your left, to the far end. The other opposite side of that. Keep going. You've gone past. Okay.
Yeah.
Yeah. At the end of that negative, look at the negative sign. That's the positive sign. Negative sign. Yeah, that one. That's it.
You can see better now.
Yes.
At the end, before the.
Yeah.
Okay. It's already done. So you can see the disposable is on this one. This is a procedure that was done in Portugal. Okay. Can you hear me, sir?
We can hear you.
Okay. So we have a disposable called the VSD, vacuum sealing drainage system, that you put on a wound. When you put it on the wound, you simulate a vacuum situation such that no contamination can go in, then you connect it to a negative pressure machine. This machine sucks out every possible exudates that would have accumulated on the wound at a periodic time, such that the place cannot afford to accumulate any form of exudates. So as a result, it will accelerate the wound healing. With this particular procedure, you don't need to actually open the wound all the time. You can actually do some level of irrigation on it. Can you hear me, sir? You can do irrigation on it without, you can do
Yes,
irrigation on the wound without opening the wound. This process will help accelerate the wound to heal with up to 50%. Is Dr. Femi there? Is not there, okay. With up to 50%.
Yes.
With this machine, once this canister is full, you can always exchange it. You can exchange it and refill. This particular product, you have an opportunity to also infuse topical antibiotics to make sure that the wound gets healed on time. In a period of 7 to 10 days, you don't need to open the wound. You can actually just open it in 10 days and discover that there is healthy granulation.
Yes. Okay, so thank you, Mr. Morrison. As far as that goes, based on what we discussed earlier, and some of the factors that militate against wound healing, this machine is notably very, very efficient in the management because, number one, it helps to mitigate anemia. Now, when you talk about anemia, it means that there is lack of blood supply to that particular wound. And what this machine does is, as a result of the negative suction pressure it exerts on the wound, on the sealed surface of the wound, as you can see, okay, it kind of pulls blood or sucks blood from the blood vessels, capillaries, arteries around that wound to the wound surface. And of course, we understand how that can quickly accelerate the healing of such a wound. Secondly, this machine is adapted to also allow for irrigation of the wound. That is, we can pass ammonia through those tubes, as you can see in the picture, okay, to the surface of the wound. And after a while, still have the machine suck the fluid and the fluids that come out of the wound surface back into the canister. Now, apart from that, it also allows the introduction of topical antibiotics where necessary. Of course, I do understand that the cases of using topical antibiotics is new these days in wound care. It hasn't really been a common thing. There are some topical antibiotics that are proven to be very, very efficient in keeping our wound clean and free from infections. Okay. Another thing is the machine is also adapted in such a way that the parts are reusable. It is more or less like a stationary nurse. I mean, it helps to also mitigate the issue of constant wound dressing. Imagine having to dress a wound, an alternate day dressing or an everyday dressing. There are even some wounds that require morning and evening dressing. So in this case, in the case of this disposable, you do not have to bother. The machine is like a dressing, it's like an automatic dressing that takes care of the wound cleaning without having to redress it. It removes all the exudates and slough tissue, okay, that would otherwise also reduce the speed of healing. The negative pressure, as I've said, helps to pull blood from all the neighboring blood vessels, the structures, capillaries, arteries in that area, okay, towards the wound surface, therefore accelerating the speed of wound healing. Dr. Femi, welcome back. Okay, and also this machine is designed in such a way that it can work for some time and stop for some time. It has an auto timer so that it helps in centers where you don't have the staff strength. For example, you don't have a nurse to do this wound dressing as regularly as it should, this machine takes care of that. It is very durable. Okay, it comes in different parts. There are the battery operated ones and there are the direct power source ones for centers that have uninterrupted power. So this machine sort of, it replaces the everyday nurse having to stand over a patient, dress wound, and the agony of the patient. Of course, you know how some wounds can be. In the case of a burn wound, to redress or change the dressing of a burn wound patient is hell on earth for the patient. Having to take out the old becomes key after a few days or after some time, but this machine replaces all of that. And so you see that this machine have been used and have been proven to increase the speed of healing by up to 50%. That is, for a patient who should be hospital bound for up to 30 days, you can reduce that to 15 days. And this is tested. If my principal would please show some other slides, you will see areas where they have been used, where this machine have been used successfully, even by different organizations, by different treatment centers. Like in the University of Benin Teaching Hospital, this equipment is very well known and well used, okay, and several other centers, even the Nigerian Army, okay, because as you know, this machine takes care of, it is formulated to take care of different kind of wounds, puncture wounds. There are those for internal wounds and surgeries, and it is adapted for different kinds of surgery, even cardiothoracic surgeries, trauma surgeries, neurosurgery, and different kinds of surgeries. I just found a way to see the relevance of this machine for those who know. Thank you.
Right. Thank you so much. Because of the time, we might not be able to go do.
I can hear.
More. I know that there's so much for you to talk about. Thank you so much, because I think that this seems to be a very, very interesting technology. I didn't see it when you were telling me about it, and then I thought this might be good for us to bring out so that our colleagues can see the value in it, especially when it comes to wound care when we're struggling. And I think you've actually demonstrated that this morning. So do you, just to wrap up now, Mr. Morrison, do you have anything to tell the public or colleagues? We only have 2 more minutes. So in 1 minute, if you can just wrap up and tell us what you want to tell us about this, technology, and then we then can close.
Okay. Thank you once again, Dr. Femi. Like I said, this device is actually unique because you have the ability to irrigate the wound while the product is on it. That's why you can actually leave it for that long to heal, because you can irrigate on a daily basis, which helps with healthy granulation of the wound. By the time you are taking off the seal, you will see that everywhere is well granulated and the wound would have been successfully healed. And we as a company, we're looking forward to people adapting to change. This is the way to go, where you can actually, deploy this technology to.
So do you manufacture these products, or how?
We have a partnership with a company in China that we represent.
Right. Okay.
Biotechnological company.
Okay. Thank you so much.
Yeah.
So I think of importance today, we've talked about, wound care, and we know that there are different types of wounds. We know that there can be challenges in wound care. And then thank you to Dr. Maxwell. Thank you to Mr. Morrison. You've explicitly discussed, with us what we need to be looking out for, especially when we're dealing with wounds. We need to make sure that our wound is as clean as possible. As soon as you start contaminating your wound, you're creating long-term problem, big scarring, infection, delay healing, and that's from primary, wounds. Then you then have chronic, wounds coming on. So when you have a situation where you have a wound that is quite difficult to manage and you're struggling, I think this is where this device becomes very, very useful. And we've seen the component today. I'm still going to learn more about this. I think really I need to know more about this, and then maybe I need to bring you back again to come and pitch. Probably just talk about the various old, so that colleagues can benefit from it. If we're going to contact you, how do we reach out to you?
Okay, our office is in Port Harcourt, 31 Emekuku Crescent, D line, and you can reach us on 0806 350 8690.
Okay,
We'll
thank
be
you so much.
available to meet the need over there.
Thank you so much. And sorry, some people are just joining. We only have 30 minutes for this program, and we're running up now. I really appreciate your coming in. Thank you, our guests today. We look forward to, probably collaborating with you and working with you again. And for the viewers, thank you for always being there. You are the reason why this program, still holds. And we obviously look forward to seeing you again next week when we come with another topic of interest. Thank you. Have a nice weekend, and bye-bye.